Hello guys, welcome to my channel. In this video I am going to discuss about the two important syndromes in rheumatoid arthritis. One is Caplan syndrome and another one is Felty syndromes. These two important syndromes asked in the university exam 5-mark questions. Okay, first Caplan syndrome. It is the combination of rheumatoid nodules and pneumoconiosis. Rheumatoid nodules occur in the pneumoconiosis, that is the Caplan syndrome. And you can easily remember with the characteristics are Caplan, that means C for calcification and A for alveolitis and B for pneumonitis and L for lymphadenopathy and A for arthritis and N for nodules. And it is the rarest condition. You can clearly see here rheumatoid nodules. And Caplan syndrome is associated with rheumatoid arthritis and silicosis and cold-worker pneumoconiosis. And the common symptoms is related to respiratory system, cough, dyspnea, chest pain, fatigue and joint pain and swelling. And coming to the Felty syndrome, it is the one of the important repeated 5-mark question. The risk factors are the onset is between 50 to 70 years and most common in females, and you can most common in European, and it is the long-standing rheumatoid arthritis and deforming but inactive disease. It is the seropositive for rheumatoid factor. The common clinical features are splenomegaly, lymphadenopathy and weight loss and skin pigmentation, keratoconjunctivitis sicca and vasculitis, recurrent infection and nodules. The triad of the Felty syndrome is splenomegaly, nodule and neutropenia. This is the triad of Felty syndrome. And coming to the laboratory findings are anemia, that is normochromic and normocytic anemia and neutropenia and abnormal liver functions and thrombocytopenia and T-cell B-cell immunity impairment. Okay, this is the laboratory findings. The treatments for Caplan and Felty syndrome is as usual the treatment for rheumatoid arthritis, and it is also symptomatic treatment. Here you can clearly see the triad splenomegaly, nodules and neutropenia. That's it. Thanks for watching. Subscribe to my channel and share to your friends for more 5-mark question related videos.